Alright, so this is the first introduction video to the Izick channel. The Izick channel is a YouTube channel that is supposed to provide disease updates for people, specifically in the United States, because that's where most of the data I have access to and can actually read is in the United States. However, in the future, as I advance through my major in biomedical engineering, I will be able to learn more about different health topics that I can be able to post on this channel, and I will be able to gain more sources overseas from European countries, particularly the EU, places in Latin America, East Asia, eventually move on to India, Oceania countries, get all that information together into a database, or just be able to present it to you and go region by region is the main intention. Eventually for this channel, I will also go over to the point where we have discussion videos for each disease. I'll also read papers, give a research finding inside those papers, present it to the people watching, and we can make hypotheses, and we'll put that as a reminder for other diseases or just as a tab note for if we see new things happen. So, main format for this channel, and I'll end this in 30 seconds. Main format for this channel will be videos, discussion videos, report videos, at least one report video a week, and then discussing videos around, I guess, hospitalizations. Well, not hospitalizations, but more new variants, what to expect, DNA reassortments. For example, the flu, we'll do a reassortment, and then also long COVID, other stuff like that, chronic disease, and then I'll have longer videos specifically for each disease type of what to expect from them, how you can prevent each type, what symptoms that your immune system causes to fight back, things you can do while you're ill. So I'll get all that information together, present it, and I'll try to make it as the most informative as possible and professional, because I don't want this to be an unprofessional channel, if possible. Okay, so beginning now. The first thing we're going to look at in this video, I hope to keep this under about 30 minutes, is the maps. So we have multiple maps that we can look at. We have Wastewater Scan Dashboard, which is a organization based out of, I believe, Emory University. No, not Emory. It's based out of Stanford University in collaboration with Emory University, where they look at wastewater throughout the United States. They have about, I think, 100 sites that resemble about 12% of the United States population. So based off that 12.5% of the population, some states are higher, like my state, New Jersey, is closer to 25%. We can be able to get large extrapolations of data so we can make general assumptions about what's happening in the population. Other maps that I have available here that we can also check is the CDC influenza-like illness map. This is not for influenza specifically, it's just a respiratory virus disease map of people showing symptoms. We'll also go over that. Because I don't have access to hospitalization data, death records right now, I can't bring those up, but in future videos I will try to bring those up and be ready beforehand about it. We'll read like a general statement, although I won't go through these too much. Use this as like a general statement, talk about respiratory disease illness, data channel, general trend, but we're more looking at local trends like the maps, and then we'll zoom in deeper into wastewater values, and I'll also use JP Whelan's data for numbers for COVID specifically, because we don't have numbers for flu and RSV in terms of percent of population. So COVID will have a much more accurate number on the number of people actually infected in your given community, and I'll also be able to tell you things you can do. And we'll be able to look at hyper-specific areas. So what I'll do before a video like this, I'll look through all the states and I'll key in on some specific areas which I think will be very important at looking at. But since this is the first introduction video, we're just looking through everything at a glance, and then we'll go much deeper into everything in the next video. And for the next video, we'll probably focus specifically on influenza because of its very high transmission rate right now. This is not a video I wanted to look at. Excuse me. Also, I will use Dr. Michael Hoger's PMC, Pandemic Mitigation Collaborative Model, Not all the time. I'll mix it with JP Wellens because JP Wellens is more accurate in terms of raw data numbers. But Mr. Hoger's, actually Dr. Hoger's model, even though it's not as accurate, the data table underneath is pretty good at being able to visualize what we're actually talking about. And they have have data, not data per se, but they have projects where we have information on how to prevent disease spread. And also we have videos about what to do, what's already happened, those sort of things. So even though the model itself isn't 100% correct, we will still use a decent amount of resources here, but we'll also look at other resources to see what's really going on to give you the best information possible. For Canadian viewers, I will try to get that information that I think Tara Moriarty makes in Canada. I will get that information here and translate it for you as well. So we'll begin, actually, not on this page, but we'll begin with, we'll start with the illness map. Influenza season week 5 map. So we're going to start here. Currently, nationally, influenza itself, although this accounts for all infectious diseases that are respiratory, influenza itself, influenza A specifically, this year right now, is the highest it's been in 15 years since 2009. And in 2009, we had the H1N1 swine flu pandemic at that time. Now, there's some theories as to why the wave this year is a bit higher than what it was last year. Some people are hypothesizing that this is probably a mix of COVID, of the large COVID wave over the summer, weakening people's immune systems, making the flu season this year a bit worse than what it could have been. However, there's also more likely explanation of we have a genetic reassortment of what we're looking inside flu strains, where we're seeing some flu strains within the data that aren't properly assigned to a specific variant, like H1N1 and H3N2. We have undefined subtypes there, so it could be a reassortment that's getting us above epidemic threshold in some states. It could also be maybe some H5N1s mixing in, which is bird flu. However, that's probably not likely the cause, but some of it is probably mixing in. So the higher flu that we have right now across the United States, the more likely that there's a chance that a current flu strain that is circulating mixes with a strain of bird flu, whether it be the D11 variant, which is in wild birds and that's very lethal in humans who have gotten it, or the dairy cattle version that's a bit more common in people. So as we're looking at the map here, as you can see with my cursor, we have very high levels in the following states, which are New Mexico, Texas, Nebraska, Michigan, Ohio, Tennessee, and South Carolina, New Jersey. New York City also has very high, the top of the scale here, in terms of influenza-like illness. We'll just say respiratory diseases in general. New Hampshire and Massachusetts are also very high, on the highest end of the scale. There are also plenty of other states, especially in the deep south, that are in the middle, very high range. But most states in the United States are around high to very high respiratory virus transmission. Now, the main things driving is obviously influenza A. It's the big one right now. COVID, not so much. COVID, we had a large summer wave, so the winter wave is not going to be as big because we don't have a new variant coming after it. A lot of people just had the virus recently. So the protective immunity, even though there's no immunity to COVID per se, the time where the immune system is actually able to keep you from getting sick again hasn't passed enough time for that to end. So because there's no variant that's significantly different than the KP variant circulating over the summer, back in July and August when we had about 1 million infections a day, but if you use JP Wellens' numbers, around 900,000 a day, which is still very high. If we do that, then nationally, not regionally, nationally, a lot of places are a lot lower than their summer peak. In the Midwest of the United States, it's different. Midwest, they are at their summer peak, but they're not at last winter's peak, which was the second highest peak in terms of wastewater. And I'm about to show that right here. I believe I can find it. It's not in this section, so let me get rid of that tab. It would be here. So this is a COVID-19 you saw monitoring in the United States. The CDC does have a map, but they use a different color scheme, and this makes it look calmer than what it actually is. But generally, the darker blue that you have, the higher the overall transmission would be. So if we're talking JN1, which was the dominant variant back in early winter 2024, late 2023, early 24, from December to February, and then its dominance slowly went down as the spring went on and new variants started popping up, leading into our large summer wave. Peak prevalence around New Year's Eve was about 4% of the population was actively infectious with COVID. So that meant that over the past month before that, and just after that, if you extrapolate from a 2% to a 4% range, roughly a quarter of people in the country contracted the virus at that time. And at that time, you also had at least 1,000 deaths a week. And I think a few weeks in September, there were 2,000 deaths a week. It's a far cry from the 3,000 deaths a day in the peak of the pandemic in terms of death rate. However, we also have to recognize most people have had the virus by now. So their immune systems have experience fighting the disease, but that doesn't mean that it's mild or anything. That just means people have experience, so the virus doesn't get enough control where the immune system has to get, where you have to have a strong immune response to counter that, and that can lead to death. So acute severity is down, but because waves last longer now and infectivity is higher, that means a lot of the long-term impacts of COVID, which would be chronic coughs, fatigue, is an endless list of conditions, but it affects basically everything in your body. That has increased because the amount of people getting infected is higher, but because the disease is so prevalent, there's not enough time for antibodies to protect against severe disease to go down. So these are the same map. Most states are around moderate to high. The highest states are in the Midwest, whereas in the West and parts of the South are moderate. But whereas in the West, it's lower on average. And I can show that using the national regional trends here. So currently, COVID-19 in the United States is high. But where we're looking at, the national number is here. The national number is at a 5.06. At the peak of the summer wave, we were about at, where were we? If I can get the data here. We are about at a 9.04. So big difference. So we're looking around 1.5% of population actively infectious with the virus right now, which is SARS-CoV-2. But back in the summer wave, we were looking at around 3% of the population, or roughly 1 in 33 people, and in some places 1 in 20 people, especially in the western and southern United States. Not so much in the Northeast and Midwest at the time. But if I expand this out, which this is Omicron on the way back here. But generally, the large waves in 22, there was no real break in 2022. There was this sizable break in 2023, and we had the flirt variant of the XBB variant over here in the summer and fall. So we had a smaller summer wave, but the Northeast kept rising after that point. But JN1 here is the second highest on this list. If we include stuff before 2022, this is still second highest, which I could pull up JP Whelan's statistics for that. So this was closer to 13.77. So this is what 4% of the population being infected will look like, compared to now where we're at 5.06 as a national number. So we're close to 1.5 to 2%. This is a big difference. And because there's not as much COVID around, that also helps other viruses infect people because there's not as much viral interference going on. Now, if we were to look at flu, for example, even though this is high, I'll use this as a general indicator. Respiratory illness in the United States is very high, according to the CDC. But in terms of emergency departments, COVID-19 is low. Now, that makes sense because the overall transmission is lower. But also have to take into account testing is not the same at hospitals. They're not testing as much for COVID-19 as they were earlier in the pandemic. We're in a later stage of the pandemic, so they're not testing as much, and there's not really much of a government incentive to test. Flu hospitalizations to the emergency department visits are very high, and RSV is decreasing. But when we look at wastewater, all of these except RSV are high. RSV is moderate, but I think it's coming off a high point. And the national summary is down here. RSV is declining. COVID is also slowly declining, but influenza is still going up. So we're going to look at that now, which is not this one, it's this one. So flu, specifically influenza A, around the nation, because some states have more reporting sites than others, is very high. So in the vast majority of U.S. states, influenza A transmission is very high, and this was about 10 days ago. But we're still seeing, this is still probably going up, or if it's not going up, it's probably peaking, but we have to see. Because wastewater data is usually always a week behind because it has to be sequenced in a lab, and that information has to be sent back to a public health department for analyzation, and then that data gets posted here. It takes time for wastewater data to come out, but it's highly accurate when it does. But just always remember, this is a week, or this is about a week behind. So when this updates very soon, this will be much closer to what we're actually looking at. So then we'll be able to tell if stuff is still going up or whether it's going sort of starting to peak, plateau, or if it's finally starting to go down. So national trends, if we look at the national trend and we go by region, there's no regional trend here, but I can look at all results here to compare between flu waves. So this flu wave right now is still going up right here. So the flu wave this year started around December. It started late, but ever since December, it's been exploding. And we've been going all the way up here, all the way through December and January, and now we're at the second highest since 2009, officially. In 2022, we had a similar type of wave, and I'm not sure if the testing capacity, if the wastewater surveillance capacity was the same back here. Because there's more sites now than I believe there were here. But if we compare these apples to apples and assume they're the same thing, this flu wave is pretty similar to the one in 2022 in terms of actual height. However, that flu wave in 2022 peaked in December and started going down by the time we entered January. This one's peaking quite late as we're going into February. It's not like last year's flu season, where flu was on average slower because you had a large COVID wave at the time, suppressing that. So these are the definitions between minimal, low, moderate, high, and very high. They use a different system. I don't have an actual number around percentage for this, as I would with COVID, but just know if someone's sick right now, it's most likely going to be influenza A if you're in the United States. Now, it does depend on your region. So, for example, a place like Alabama is very high, but we could check another state. So we could check a place like Maine, for example. And Maine is high. And if you click on one of these sites here, I believe you could click on these sites, although I don't know if you can, but these sites here give a general look of how transmission is in a general area. So closer to Portland, Maine, transmission is much higher than in this spot around Knox County. But Knox County may not be surveilling as much. So those are things to consider. Because some sewer sheds are smaller than others, so they resemble less of the population. So if a wastewater shed resembles less of the population, it's not going to be as accurate as one that resembles 25% population. So for example, like here, even though like nationally, Maine's following the line pretty closely, you can see there are times it deviates here. So I'd always recommend, and I'll expand this, like see here. So the flu wave nationally in 2022, Maine has a much higher flu wave in 2022 going into 2023. The flu wave in the United States peaks earlier in 23 and entering 24, but in Maine it peaks later. So it's more important, if you're looking at the CDC website, it's more important that you look at your state than to look at other metrics. Region is good. A national picture gives us an overall look at what the nation is looking like. But we're more interested in what your state is looking like, because the state provides a lot more local transmission information to you specifically. And I'll show you an example here. Not with flu specifically, because flu usually has a same trajectory in most states. But we'll look at, for example, I'll go back to COVID here, and I'll look at Florida, for example. So we'll look at a state trend, state and territory trend of my state, New Jersey, and then I'll look at Florida as a comparison. Because the states by state differences vary. There's a lot of state by state difference due to climate, how people interact, because the behavior of people in different states is different. Because of the weather, geography, transport, things like that. So, for example, New Jersey COVID transmission looked like this, where the national in 2022 was higher in the national, but in the state it was very low. It's low, not very low, but it's lower in comparison to the average. Whereas in the wintertime, the average in the state is much higher than what it was nationally. And you still see divergences as well, where it doesn't go as low sometimes as the national. And then in the summer wave of 23, it was much higher than what the average was at the time for national. And in the winter wave, much higher than that still. This is what I mean by looking at a general state-by-state basis. Because a state-by-state basis, you can look at, always what I say, for transmission specifically next to you. But you need to come to this, look at your state, and go by a state-by-state process. So in Florida, COVID-19 levels are moderate right now. But over the summer, the average was here, but they had a much, much larger summer wave that peaked earlier than it peaked nationally. And if I expand this out, you see in Florida, the pattern's a bit different, where they have a large summer wave, per se. They have a larger summer wave on average here. 22. They have a larger summer wave, but they have a smaller winter wave. And that's mainly due to, in the summer, when people stay inside, because in Florida it's very hot and humid. Because of that, people stay inside. They're more likely to spread illness among each other because few people are wearing masks, few people are sanitizing things. But the main thing for COVID specifically is airborne transmission, so you have to wear a mask when you're around people if you want to prevent illness. For influenza, it's a bit different. Influenza is still an airborne disease, so if you're not wearing a mask, it's still easy to catch influenza. But influenza, you have to be more careful about what you're touching as well, because influenza is also a fomite-transmitted disease. A fomite-transmitted disease would just mean that if you touch another surface, the disease is still active and you could spread it by touching something else, touching your face, and then the virus can enter your body that way. Versus just the airborne route, like for COVID mostly, where you inhale the virus. So if you have a respirator mask, N95, that filters most of that out, and even your nose can filter out the rest of the virus that gets in, you're going to have a very low viral load that can actually infect you, that your immune system can scoop up before it becomes a problem. So we went over COVID-19, we went over flu. We'll look over RSV as well, just because this is also important. Now, nationally, the RSV wave is not as high right now, but we can look at all results and see the RSV wave in 2022 and last year was much higher than it was this year. Now, this year is probably lower because flu is outcompeting it. The 2022 wave, COVID was helping a lot with suppressing people's immune systems on the people who were infected. So that helped with the RSV and flu wave in the winter of 2022-23. Same kind of idea for 23-24, except that the COVID wave was much larger. Well, it's larger, but it's also wider wave, so that helped out RSV as well here. But because COVID doesn't make the immune system more active like the flu and RSV, when that is high, that helps these other viruses rise up because COVID suppresses the immune response afterward to a degree. Whereas if a person contracts flu and RSV, those raise the immune system's alert level higher, so it makes it harder for COVID to transmit, if that makes sense. I'll try to get an official document of a source where I can link it to you guys about that, but that's the general trend of what we usually see in terms of disease transmission. I'll also pull up a map for transmission, because in some states it's higher than others. So for example, Florida, you have high RSV transmission, whereas in Ohio it's minimal, and we have 71 sites reporting. So depends on your state. Missouri is very high, but a decent amount of states in the United States for RSV are high to moderate. transmission. Still something to look out for. Still something that you need to pay attention to. If you can get a test to identify what illness you have, whether it be flu, COVID, RSV, or whatever other infection, norovirus, for example, the gastrointestinal disease causes you to vomit for 2 days, for 24 to 72 hours, which is just 1 to 3 days, and have constant diarrhea. If you know and get the tests early and you know what disease you have, then you can go out and buy specific antivirals for your treatment. So for COVID, that would be Paxlovid. For flu, that would be Tamiflu. But for flu especially, you want to be able to get it in the first 2 days of symptoms because it doesn't actually stop the virus, just slows it down. So you need to be able to stop flu before it gets to the point where it either overwhelms you or before your immune system really starts fighting it back. You want to make sure that your immune system is able to get to the virus and slow it down and crush it, but not have to work as hard to do that. Because your immune system is a system. It's like an army fighting. It's an army fighting another nation. Like, for example, I guess we can use the example of the war in Ukraine, for example. You have Ukraine versus Russia. You have two armies fighting each other. Attrition does happen and collateral damage is a thing. So more fighting doesn't help your immune system per se. So anything that can ease the fighting that your immune system has to do and makes this job easier is better for you overall. Because your immune system's not going to waste as many resources. You're not going to be sick as long. And both the virus and your immune system can't do that much damage to you. Because the virus is going to be able to be suppressed faster. And your immune system is not going to waste as many resources. And it's not going to overreact and potentially give you a reaction that may kill you. Or lead to a severe issue where you develop a chronic disease afterward. That's the main thing that we're looking at. Finally, for this video, just a small thing we're going to talk about. So, in the future, I will do videos on cryptic lineages. Probably not super long videos, but we'll try to do discussion videos around infections in people and immunocompromised people that could lead to emergence of new variants. So this is specifically for COVID. We're going to be looking at diseases in people, potentially new variants that could jump out of people looking at cryptic lineages. So people who have COVID before and have persistent infections that last a long time, and then they have the virus evolving within them and then eventually escapes. We're going to be looking at that. And then we're also going to be looking at what else could happen. Recombination between variants. We'll look at the same thing for flu. We'll do a longer discussion video for that, but it's not going to be a report style like this. So in those videos, we're not going to do a step-by-step report. We're going to look at one disease specifically. We're going to get as much information as we can. We're going to compile it. We're going to analyze it. We're going to have a discussion if possible. I'm going to try to explain it best I can. And then if anyone who's actually in the comment section who has more expertise than me can explain it to me, that would be wonderful because then I can explain it better when I have to cover it again. But I'll also pull up some of people follow. So Mark Johnson's one person, at saw evidence on Twitter. JP Wellen's a decent person as well. So this was their forecast back in November for the 2024 range of the wave. So around 600,000, 800,000 infections a day. And it was where the actual line is, but range could be anywhere from just under 400,000 to about 800,000 cases a day. And also, this is his work over the past, I believe this is 5 years now. Even though the pandemic officially was declared one in 2020, it's year 6 of the pandemic because you've gone through, it's been 5 years since the inception, but the first year is year 1, technically. So this would be the 6th year. And then the 6th year ends at the end of this year. And then we enter the 7th as we go into 2026. Also, you could technically call it the 8th year if you count in 2019. So this is his data. So as you can see here, the early 2020 wave. It's missing the early 2020 wave. But we have the 2020 wave in winter over here. That killed, I think, about 100,000, 200,000 Americans. I have to go back and look at it. The Delta variant here. Omicron, 5 million infections a day. Very sharp wave. And then after Omicron, it's more been, we don't see large waves like Omicron where we have a large lull. It's more, we have a lull here, but it's quite high on average, still 200,000 infections a day. So overall, low is still pretty high. So it's still high infections throughout the year. And compare it in absolute terms, and then we have waves superimposed on top of that. But it's more closer to what T. Ryan Gregory would say, where it's not tsunamis anymore, it's more high sea level. So we're more in a situation now where our average sea level is higher, so instead of us being 10 feet above sea level, we're now 7 feet above sea level. So that storm that brings a 10 feet storm surge, brings a 10 feet storm surge that's able to flood that area, will now come more often because the amount of water it's going to take to get up to that 7 feet is going to be less. This is basically the concept that I'm discussing. So JP Wellen's a good person to follow, and then T. Ryan Gregory, another good person to follow for information like this on Twitter. So if you can find people on Twitter, it's a good thing. I will leave this information in the description for you guys. I will also let you guys see wastewater scan. So for this, you can go to any location or any site that they have available. So for example, I can go to Jenison, Michigan right here, and I can see that in this general area, SARS-CoV-2, RSV, influenza A and B, and human metapneumovirus, which is another respiratory virus, are high in this area, plus norovirus, for example. And you can get a chart and see what it looks like. So you can see COVID is high in this area, but it's starting to go down. It was highest around New Year's Eve. RSV was going up and now slowly starting to go down. Influenza starting to plateau. Influenza A starting to plateau. Influenza B starting to go down a little bit. Human metapneumovirus is also starting to go down in this area. And norovirus is also starting to go down. But you can see this if you know an area close to you. So for example, if you lived in, let's say you lived in, we'll use a state that people don't usually talk about more. We'll use Kansas as an example. This little spot in Kansas, Salina, Kansas, not Texas. So you can see different concentrations here. There's less people here, so it makes sense why concentrations are lower. But in comparison to where they've been, this is high. You always have to think in terms of relatives. So I can zoom out. And generally, it's what the information will look like. So I'm going to shorten this down. So the average wastewater in the system is lower because there's less people around here. But you can still see a general pattern. When you put on national levels, they're still in a lower third here, but they're increasing for their area. But for this area, the upper third is around 400 viral copies per millimeter of water. So if you know your region, you know a wastewater plant near you that takes sewage from your general area, you can go to it. If wastewater scan has the site, or if CDC has a site, you can get the general idea on CDC, what level it's at. Here you can approximate more, and then eventually I hope someone creates a tool where we can convert this into numbers, 1 in 20 people infected, something like that, like JP Wellen does over here, if I can re-pull it up. This is probably longer than 30 minutes. I apologize, guys. But yeah, so for example, this 300, like right now, this is a bit further back, but we'll still use it. 375 new infections today, 189 currently infected, Midwest above others. These are the type of numbers that I want that we need to be able to convert it into stuff that people can understand, and then realize, okay, if I were to go into my school and nationally, the chance that one person is infected with COVID specifically would be 1 in 89. But then also, if we add on flu, RSV, all these other infections, the chance anyone is sick in any given room, that at least one sick person in a room, probably closer to 1 in 10, something like that. That's more about what we're thinking. If we can get numbers for all of them and then combine them, we'll get a much more concrete solution, and people will be able to be informed. All right, guys, I hope you guys learned something from this video. I hope the information was helpful to you. I also hope that I presented it well. I may be a bit boring, but I want to present information to people, and I want people to be able to know that there are disease updates for people. Also, just generally, before I end the video, things you can do to not get ill right now. Against norovirus, the main things you need to do is make sure all your food is cooked properly. Make sure that you're sanitizing things. Make sure you're washing your hands thoroughly for the actual 20 seconds. Hand sanitizer does not destroy the virus. So make sure that you're actually washing your hands. So even if you're going to use hand sanitizer, use it, but also make sure you wash your hand later on before you do anything that involves eating or touching anything on your face. If you're wearing a mask, touching your face is not going to be a thing you're going to be really doing. So it's just a good thing about having a mask. You're not going to be doing that because you won't need to. But for flu, COVID, RSV, those are airborne pathogens. You need to have a respirator mask for that, so you need to make sure that you're wearing one always indoors, no matter what the position is, unless it's your own home and you know it's well ventilated and you know there's far UV light. Make sure that you're wearing one just so you don't get ill. I would still do the same thing outside. The best place to eat is also outside, but if it's too cold or the weather's too inclement for you, I recommend that you probably eat more before you go out, and then when you come home or reach a safe space. And safe space is not somewhere in public. I mean somewhere in like your own home or with family that you know, like even though they may not be fully taking precautions, you can find a safe spot in there to eat. Do that, and you should be in a good position. So the main thing is to take away, to be safe in this wave and not be sick. Even though someone told me people can't control their illnesses. I know that's a lie. They can. You can't control everything because you can't control luck. But you can do enough to reduce your chances. Get a respirator mask. Stuff like full mask is good. DM auras. Purchase those. Get one that fits your face. Make sure it's tightly sealed. That's number one. Make sure that you're cleaning stuff constantly that other people are using or that you know that you're going to use. Make sure things are clean, sanitized properly. Make sure that you cook all food that you receive fully. So even if you get fast food and it's like for example, meat will be cooked well, but maybe the vegetables on it won't be cooked, and you may get norovirus from that because someone didn't clean off the food properly and didn't cook it. Just be careful of that, and also be careful of people who come in. Don't stay too close to people. Try to stay outdoors more than indoors, because indoors, infectious disease tends to build up inside the air. And even if you're wearing a mask, it helps to have one, but you really want to reduce exposure. Because the less exposure you have, the less your mask has to filter, and therefore the less you also have to filter through your own nose. So you'll be in a better position overall. So those are all the tips I have for you. That's all the information. I will try and post links in the description to all of these videos for you guys, and I hope everyone learned something. So this was Izick, even though that's not my actual name. I'm going to use Izick because that's the channel name. This is the first video. I will try and make another video, probably a report video, where I go more in depth into probably the idea of flu DNA reassortment and see why we have a high flu case count. And we can look at that and also look at the actions of individuals and see what people can do to reduce the spread right now. Because let's be honest, soup is not going to help you not get sick, even though people want soup now because they like being sick for some reason. But this is all the information. I'll catch you guys another time, and I hope you guys enjoy it. See you guys another time. Goodbye.